Okay, hello everyone and welcome to this afternoon's webinar, School Health Assessments, Healthier Schools Start Here. Today we have three presenters. Myself, Alicia Hoke, with Penn State Hershey Pro Wellness Center, Matthew Dietz, also with Penn State Hershey Pro Wellness Center, and Megan Diehl from the Alliance for a Healthier Generation. Before we get started with today's presentation, I'd like to mention that funding was provided by the Pennsylvania Department of Health through the State Public Health Actions to Prevent and Control Diabetes, Heart Disease, Obesity, and Associated Risk Factors and Promote School Health Federal Grant, and Preventative Health and Health Services Block Grant from the Centers for Disease Control and Prevention. A couple of housekeeping points. All participant phones and microphones have been muted to ensure the information shared by all presenters can be heard clearly. If you'd like to submit a question or a comment for the question and answer session that will occur at the end of today's presentation, you can enter that into the questions box. We'll reserve time at the end of the webinar to answer these questions. In addition, the webinar is being recorded. A link to the recording and the handouts will be emailed following the webinar. A link to the certificate of completion and a follow-up survey will also be included in this email. So the agenda for today's session includes an overview of Pro Wellness Center, a description of what a school health assessment is, a discussion of why schools should complete health assessments, things to consider when selecting an assessment, and then Megan will talk with us about the assessments available with the Alliance for a Healthier Generation and their partnerships. At the end of today's presentation, it's our hope that the attendees will be able to explain school health assessments and their purpose, recall attributes to consider when selecting an assessment, and to locate assessment tools available for schools. A little bit about the center. Penn State Hershey Pro Wellness Center is committed to educating and inspiring youth and their families to eat well, engage in regular physical activity, and become champions for bringing healthy choices to life. The vision of our center is to reduce the incidence rate of childhood obesity. We do this through educational programming, collaborative partnerships, and interventions with schools, communities, and like-minded organizations. Additionally, we have a Healthy Champions program available for schools and community-based organizations in Pennsylvania. It includes resources like event planning guides, promotional templates, customized champion reports, priority for future funding opportunities, and incentives like with the Hershey Bears here in Hershey, where we're located. You can register to be a Healthy Champion at pennstatehershey.org/prowellness/champs. Annual registration is required to receive your welcome kit. As a part of our Healthy Champions program, you receive special access to our signature events. We hold 2 events in the fall and 2 events in the spring, a nutrition and physical activity event in each of the 2 halves of the year. You'll see that in October we have Walk to School Day coming up and Apple Crunch. And then looking forward to the spring, we have Go for the Greens in March and Move It Outside in May. So, we're here today to talk about school health assessments, but first let's look at the environment of a school as a whole. I think it's safe to say that schools are tasked with far more than what they used to be responsible for in terms of the students who walk through the door in the morning. This model, the whole school, whole community, whole child model, was recently released, and it's a collaboration through the Centers for Disease Control and Prevention and ASCD, formerly the Association for Supervision and Curriculum Development. This model responded to the call for greater alignment, integration, and collaboration between education and health to improve each child's cognitive, physical, social, and emotional development. The framework describes the relationship between learning and health. So when you're thinking about the whole school, whole community, whole child model and its components, you probably think that there should be a way to look at the components of school health and wellness as they apply to each individual school or district. That's where school health assessments come in. According to the Centers for Disease Control and Prevention, a school health assessment is a systematic collection, review, and analysis of information about school health-related policies and programs for the purpose of improving students' health and educational outcomes. And that's a mouthful. So in simpler terms, school health assessments give schools a snapshot in time of the programs and policies that address student and staff health. A school health assessment also helps to identify the strengths and areas for improvement of school health policies and programs. So, now that we know what a school health assessment is, let's take a quick poll to determine if you've participated in the completion of a school health assessment. So please take a moment to answer the poll on your screen. Okay, it looks like the answers are slowing down. So, share these results here with you. It looks as though 37% of the attendees have participated, 51 have not, and 12 are unsure whether or not they've taken part in something, in a school health assessment before. So it looks like we have a varied audience today, and I believe that the information we're going to share with you today is going to be beneficial whether or not you've ever completed a school health assessment before. Okay. So why should a school complete a school health assessment? Assessments provide framework for determining the status of school wellness efforts, and the structure provides a central location to collect information about different initiatives that are going on in the whole school or even in the whole school district. The information gathered through the school health assessment provides directions for school health improvement efforts. It can help to identify resources that you may have to put towards school health and wellness and help to avoid duplication of efforts that are already occurring. Health assessments can help you to create and track an action plan and track activities related to health and wellness in your school or district. And probably most importantly, it's able to help you celebrate the successes of all the things that you as a school representative or within your school or district are doing well. And you'll find when you complete a school health assessment, and if you've completed one before, there's always room to celebrate successes. But sometimes school health assessments get a bad rap. There are lots of comments going around, especially with the Healthy Hunger-Free Kids Act and the policy suggestions and regulations that are coming down through that. School health assessments have begun to be given a bad rap, as I said. So school health assessments only point out where my school is deficient in areas of school health. This is false. While school health assessments provide a starting point for increasing efforts around health and wellness, they're also designed to highlight great things every school is doing. And every school should remember to celebrate their successes. Another comment that we've heard is school health assessments take a long time to complete, and school staff are busy. We just don't have that kind of time. This is also false. There are different assessments on the market, and actually quite a few that we will introduce to you, and one is surely right for you. We'll get into the specifics of selecting an assessment in the next couple of slides. Another comment was, any changes that the school health assessment suggests we make will cost money. Our school budget is too tight to make any costly updates. Again, this one's false. There are countless opportunities to better your school health environment for little or no cost, including the use of the assessment itself, because many of them on the market are free of cost. You'll see that later that the type of available resources that come with an assessment may be something you'd like to consider when selecting one. And finally, completing a school health assessment can open doors for my school in terms of funding opportunities and support from my school community. This one is definitely true. An assessment creates a picture of what's working well in your school and what areas of school health can be improved upon. Both of these provide opportunities to gain support, whether it's through volunteers or through funding for future wellness initiatives. Celebrating successes, as I've mentioned several times now, is a great way to gain support from your parents, teachers, administrators, and other community representatives. You can secure volunteers or local business financial support by celebrating these successes, or even by notifying them that you're working towards a better school health environment. Identifying areas to improve upon makes a great case for grant funders. Taking the steps to complete a school health assessment means a healthier school. You have to be aware of the needs before you can address them. Okay, so why are there different school health assessments? I alluded to the fact that there are several health assessments out there on the market, meaning the free market. School health assessments are designed to address specific areas of school health and school health improvement efforts. And these assessments vary in the content that they include, whether it's an assessment of nutrition, physical activity, safety, or even employee health. Some of them address practices, some of them address policies. And in the next couple of slides, we will get into how you can use these different content areas and what type of information you'd like to gather to decide what assessment is best for you.
Good afternoon, everybody. As Lisa had said, my name is Matt Dietz. I also am with the Penn State Pro Wellness Center, and I'm happy that you're all able to join us today. Hopefully I can give you a better overview of how to select the tool as opposed to the what and why that Elisa had provided, and addressing some of those misconceptions. So standard assessments are conducted annually in math and reading, and also schools assess graduation rates, absenteeism, et cetera, but the focus is determined by the state or other governing body. However, selection of health priorities can vary quite a bit, and it's a completely different process for each school and each school district, and it also varies from state to state. This provides a great amount of flexibility when determining what will work best for your school or your district, as priorities are identified by the assessment tool, as well as any community partners or any other stakeholders available to your school or district. When it gets right down to it, you're experts on what is going on in your school or organization. Completing the assessment will only help to amplify your knowledge of specific health and wellness initiatives already in place. If you are part of an outreach organization like us at the center, it becomes important to realize that assessment tools are tools available so that we may be brought up to speed on initiatives that are currently going on in districts that we work with, and that's just assessed based on the snapshot provided by the assessment tool. So the very first question you should ask yourself is, which assessment is right for my school? We've narrowed it down based on our work in schools. There are 5 things to consider, and that is purpose, content, technical support, completion style, and available resources. We start off with a few questions like, what is the purpose for completing the assessment? What content areas are you interested in assessing? What type of training or technical assistance do you require? Which assessment completion style do you prefer? What type of resources are available after you assess the website or sign up for a tool? And more details regarding these questions will be covered in the following slides. So here's our little graphic here overviewing the 5 content or areas of assessment tools that you should address thinking before doing work in your school district. Once all of the 5 considerations are met, it becomes a recipe for selecting your tool. The following slides provide more information on each bubble and how to make it specific to your school organizational needs. So first and foremost, we have the purpose of the assessment. This is probably the ultimate driving factor. What do you hope to accomplish in your district? So when thinking about this, it's important to note that this could be a district-wide assessment or it could be an individual school building assessment. Individually, stakeholders may have different ideas of what they hope to achieve by completing the assessment. It becomes priority to consider the scope. So if you would like to do a district-wide assessment, there may be a little more work up front, but it will give you a valuable overview of what is being done and what you can do to address the areas of improvement or simply to celebrate your successes. Also, are you going to evaluate a program already in place, or would you like to find an area to test out new initiatives? The answer is by completing the assessment tool and determining what you would like to do once you get on their websites. Is this assessment self-motivated based on something you've noticed in your district, or is it for compliance with current standards? Example, the Smart Snacks and School Guidelines that went into effect in July. This can help you identify how far behind you are or if you're ahead in terms of meeting these standards. Also, there's a policy review versus a program and practice review aspect that you should consider. Many of the schools have policies related to health and wellness or food service in their district, before and after school programs, et cetera, and they may have sat on the shelf for quite a while. Is this an example of something that happens in your school? Recently around our area, we had an article in the newspaper that was an enacted policy 5 years ago, let's just say, and they recently started implementing it based on an assessment that they had done. That's something that you should really see. Some of the work's already been done, but you might be able to just reinvigorate what has already been done. An assessment tool can help you gauge effectiveness of your physical education or health curriculum, analyze it before and after your school programs, as well as many other initiatives that you can tailor to your needs. Assessment tools can also address a variety of content, which is something that you should consider secondary to what your ultimate purpose is. Here are some examples of the most common content areas. Those hoping to assess their school's organizations can pick the tools based on certain, all or none of these areas. Here are some or all of these topics are included in every free assessment tool that we recommend. The Smarter School Lunchroom Self-Assessment, for example, focuses only on nutrition and food service questions, but there are some that are all-encompassing and also focus on more than just health and wellness, PE. It will also be environmental health, staff and employee wellness, and family and community involvement. It's important to note that you do not have to address all of these areas at once, as many tools have adapted over the years so you may save your progress. Again, these are all options that are designed to work for your needs. One aspect that is very near and dear to our heart is technical assistance. We provide a lot of that here at Pro Wellness Center. It's probably something more relevant for some of you first-time assessors, but nonetheless it's very important. This can be identified based on available training manuals, on-site trainings. Some organizations are willing to come and walk you through it in person on your own computer, or even take over your desktop and show you bit by bit. Also, they provide live technical support, webinars such as this. If you have conducted needs assessment in the past, offering technical assistance may not be an area that interests you. However, due to the increased demand for conducting these assessments, there are many first-time staff or newly formed wellness teams that will need more guidance when determining the state of their school or district in terms of health and wellness. And that brings us to one of our probably most straightforward aspects of determining what you would like when considering an assessment, and that is the style. So as you can see here, many offer online assessment tools. That's kind of the way of the world these days. It makes it easy access for anybody on your district wellness team to get a hold of or make changes as they see fit. But there are also still assessment tools that offer paper tools, if you're more comfortable with taking it home, taking it to your desk, and actually writing in some of the needs that you find. The most commonly used assessment tools do have the online aspect, and a lot of them are really working on the group entry portion, where you can go in, as I mentioned before, you may save your progress. You may go check out a different site, come back, and assess food and nutrition at a different school later. This can also be used to compare progress annually and may be useful when drafting grant applications. In an effort to cut down time spent entering information, we recommend the new tools offering group entry and access. This is extremely relevant if you have different members on the wellness team that focus on one aspect of the assessment, such as nutrition, physical activity, curriculum, to name a few. And like I mentioned, you can save, continue, and come back at a later time. If you are a champion in your school and are responsible for conducting the assessment, you may want to consider the length of the assessment prior to making your selection. And the last piece of selecting a valuable assessment tool is identifying additional resources that are available to you or your organization. Many of the recommended tools offer simply the assessment. In addition to that, there are many that also offer action planning steps, resource banks, a portal to share success stories. Proposed action plans are probably one of the most valuable tools that we identify. Gives you an upfront scorecard and tells you where you're deficient and what type of suggestions you may use to assess these health needs in your school. There are also some that suggest building a wellness team component, suggesting marketing materials. It also may be very important to your funders to identify excitement about the program, build support for your wellness initiatives in your school for future years by looking at these success stories of other schools or really pushing and sharing yours via social media and any other outlets you may think of. Free promotional resources are offered from certain organizations. It really varies from tool to tool, but some organizations offer social media campaigns, flyers, any other T-shirts. It just depends what you would like to sign up for. Some offer registration for raffles, for other free paraphernalia. It just, whatever you want to use in your school is what you should always consider. So based on our experience working with and in schools, we have found that these are the successful components of selecting an appropriate assessment tool. And I've got a graphic here for you that will show that there are a variety of schools. However, it's important to do the work up front, do your research and your homework, and see what works best for your school. The takeaway from this section of the webinar is simple. Determine what your purpose is for conducting the assessment. Define what content areas in health and wellness are important to you and your school organization. Consider your preferred levels of hands-on technical assistance. Contemplate the style of assessment tool that will be the most user-friendly for your needs, and look through the available resources out there. These are all free resources that we're recommending. There are some that you have to pay for, but we believe that you can get the job done with these available tools. Take time to consider all of your goals up front, collaborate with your teams, and tool selection will be simple. Our guest speaker, Megan Diehl, is going to talk to you about a valuable assessment tool that is a collaboration of work by the Alliance for Healthier Generation and the Centers for Disease Control and Prevention. Megan is the National Network Manager at the Alliance for Healthier Generation. In this role, Megan is focused on expanding and delivering professional development strategies to organizations working towards changing school and out-of-school time environments that support health of young people in their communities. Prior to this role, Megan served as the Healthy Schools Program Manager in Florida for over 3 years, where she was responsible for the overall management and implementation of the Healthy Schools program in school districts across the state. Megan came to the Alliance with over 8 years of experience in healthcare marketing and communications. She has held various roles in the pharmaceutical and health insurance sectors, overseeing the development and execution of medical education programs, patient education initiatives, and strategic marketing plans for domestic and global brands. And without further ado, here she is to introduce her tool.
Thank you, Matt. I just need to get my presentation loaded here. And if you wouldn't mind, okay, here we go. Can everybody see my screen okay?
We are seeing it, Megan.
Okay, thank you so much, Alicia. Good afternoon. Thank you so much. Thank you, Matt. Thank you, Alicia. Thank you, Penn State Pro Wellness, for this opportunity today to talk about some strategies for building healthier schools in your communities, utilizing the assessment tools and resources available through the Alliance for a Healthier Generation. Like Matt said, my name is Megan Diehl, and I'm the National Network Manager here at the Alliance for a Healthier Generation. For those of you who are not familiar with the Alliance, we were founded by the American Heart Association and the Clinton Foundation with the goal of reducing the prevalence of childhood obesity and empowering kids to develop lifelong healthy habits. Before I get into our specific school strategies, I just want to give you a little bit of a high-level overview of the Alliance. Since our founding in 2005, the Alliance has made significant progress as a catalyst for children's health. We collaborate with people from anywhere that impacts childhood health. We work with schools, companies, community organizations, healthcare professionals, and families to transform the conditions and systems that lead to healthier kids. We believe that if we can empower the people who influence these environments by giving them easy access to the best resources and science-based best practices, we can create a movement that transforms the places kids spend their time. So today I'm going to talk about our efforts we are most well known for, and that's our work with schools. Every day, as I'm sure this audience knows, 95% of school-age kids attend school, and besides home, it's where kids spend most of their time and why it's an ideal place to instill healthy habits that can last a lifetime. And as seen in the previous slide, our evidence-based Healthy Schools program is currently in more than 24,000 schools in every state, impacting more than 14.5 million children. The Alliance's Healthy Schools program is the country's largest school-based childhood obesity prevention initiative. As I mentioned, our work is in the area of childhood obesity prevention. So the Healthy Schools program focuses on helping schools create environments that promote nutritious eating and physical activity for students and staff, essentially to create a culture where healthy eating and physical activity is the norm and not the exception. We provide assistance to anyone wanting to help a school become a healthier place. So at no cost to districts or schools, we provide the tools and solutions to do just that. We also offer the opportunity for schools to earn a national award for those efforts. So the Alliance outlines a course of action for making sustainable change through our continuous quality improvement process called the 6-step process. Our first step is to build support by convening a wellness council to plan and lead implementation of wellness efforts. And we found that this is going to be the foundation for any school's success and sustainability with implementing best practices for physical activity and nutrition. The next step then is to assess your school, what we're here talking about today, completing an assessment to see how well each school aligns to best practices in school health. And by completing this assessment, the results are going to show you where each school's strengths are, what they're doing well, and then it helps them to identify areas that they can improve upon. Step 3 then is to create an action plan based on what's important and achievable in each unique school community based on the results of that assessment. Step 4 is to explore and identify resources that can help achieve the wellness goals that are outlined in the action plan a school has developed. Step 5 then is just to take action and take those implementation steps necessary to help each school achieve their wellness goals that are outlined in the action plan. And then step 6 is to celebrate successes, and I know this was previously mentioned. This is such a critical step, and unfortunately it's often overlooked. We think that celebrating and communicating your successes really helps to generate enthusiasm to keep the momentum going and to build further support for your efforts. And the Alliance offers a number of different communication channels and supports to help schools do this, including our Success Stories database. The Alliance recommends that each school work their way through this 6-step process of continuous improvement at least once per year. And like I said, we provide support along the way for schools to achieve each and every step of the process. And in fact, each time they update the assessment and complete the assessment, it's a valuable way to measure progress that a school is making. The 6-step process is also a great way for districts and schools to meet the local wellness policy requirements outlined in the Healthy Hunger-Free Kids Act, such as assistance with building school wellness councils, criteria to set goals for nutrition education, physical activity, and nutrition guidelines, and an assessment to measure wellness policy implementation and district reporting of those results. The Healthy Schools program is based on a set of best practice guidelines that are contained within the assessment. These best practices have been developed by a national panel of experts from across different organizations, including the U.S. Department of Agriculture, the Centers for Disease Control and Prevention, the School Nutrition Association, among others, who all agree that in an ideal world, an ideal healthy school would be doing these things. These guidelines are called our framework, and they provide a comprehensive roadmap to creating a healthier school environment. And the framework is comprised of a comprehensive set of focus areas that address school health improvement, and these include policies, health education, physical education and physical activity, nutrition services, health promotion for staff, and family and community involvement, many of those wellness categories that were covered by Matt in his previous presentation. These guidelines also form the basis of our National Healthy Schools Award, which awards schools at the bronze, silver, or gold levels. Having a quality assessment is very important in creating change over time. Every couple of years, we actually collaborate with others to make sure that we have a quality assessment, and we update it to reflect the latest evidence-based best practices. We're extremely excited this year to announce that in our most recent update, we collaborated with the Centers for Disease Control and Prevention, the CDC, and adopted and updated the School Health Index together. Both the Alliance and the CDC will use this one unified assessment tool to guide school-based obesity prevention and health promotion. The Alliance's previous assessment was largely based on the School Health Index with some modifications. We hope that this new unified assessment tool eliminates some confusion, enables better coordination of training and technical assistance across and within the two agencies, and allows for increased opportunities to promote the use of the Healthy Schools Program 6-step process to address other areas of need identified by districts and schools. As the newly unified School Health Index is the Healthy Schools Program assessment tool, we want to here illustrate that the Healthy Schools program is using all of the modules that relate to our focus of preventing childhood obesity, such as physical activity, nutrition, and cross-cutting questions. These cross-cutting questions impact all areas of coordinated school health, such as having an active wellness council and having parents and community members involved in the decision-making process. There are some cross-cutting questions that do not directly relate to our area of focus, such as questions on asthma, tobacco, safety, and sexual health. So they are not included in the Healthy Schools Program version of the School Health Index. However, on the Healthy Schools Program website at schools.healthiergeneration.org, you will see all of the modules of the School Health Index and see that it is made up of 8 modules. 2 of the modules are completely optional because they do not focus directly on preventing childhood obesity, but schools can complete them if they'd like. Also, each module has required questions followed by optional questions. The required questions match the best practices that are in our Healthy Schools Program framework. The different module topics make it easy to divide the assessment up so it can be completed by different staff members or team members at the same time, either online or via our downloadable assessment guide. In updating the School Health Index, we made the strategic decision to focus on what matters most. There are now only 50 required questions, and for those of you who may have been familiar with the previous Healthy Schools Program inventory, our old assessment tool, you'll know that's down from the 103 questions that we had previously. As you answer the questions, look at the top of the screen to see if a question is actually required. As I mentioned, some questions are required for the Healthy Schools Program framework and some are optional as other parts of the School Health Index. To answer each question, there is a 0 to 3 scale, with 0 being not in place and 3 being fully in place. These graded response options will make it easier to share progress over time with the school community. It will also help the Alliance provide more targeted technical assistance and resources. So now for some tips on completing the assessment. So remember, in our 6-step process, I pointed out that the first step is to develop an effective and engaged wellness council. Having a team to help you increases the school's chance for making impactful, sustainable change. So we recommend that at your first committee meeting, you divide the assessment by wellness category and assign them to committee members. If you divide the work up, it's going to be easier on everyone. And in addition, every team member can actually create an account on our website and work on each piece of the assessment individually on their own. Next, it's okay to answer each of the questions on the low end of the sliding scale. If you don't have something fully in place or you're not meeting it at all, that's okay. There's no penalty and nobody's going to look at the school poorly. On the contrary, it gives a true baseline of where a school is at and demonstrates what can be done to improve. There's no need to actually collect evidence when completing the assessment. In order to apply for a Healthy Schools Award, we do require evidence that you're successfully meeting the criteria, but that's not what the purpose of the assessment is. For now, the focus is getting a true baseline of how well the school actually aligns to best practice criteria. And finally, all of the answers will be entered into each school's own unique page on our website. as I mentioned, we do have an assessment guide that can help you actually complete the assessment, and it's downloadable and printable for you to, if you choose to do it on paper or to divide it up physically, you can do that, but we also have some great features on our assessment guide to help you answer each question. First of all, you see that we'll have the question fully written out and the different ways that you could possibly answer it. We also give suggestions for people who might likely know the answer to each of those questions within the four walls of your school building. We also highlight the evidence of success that would be required if you were to apply for a Healthy Schools Program National Award. And although you don't need to collect that evidence right now, it's a really good barometer to help you answer the question. So if you're not sure if you're fully meeting the criterion or not, you can always look at the evidence of success and say, if we needed to, would we be able to provide that evidence of success right now? If yes, then you can answer yes, you're fully meeting that criteria. And then we also show you what level of award each question corresponds to. And you can find that assessment guide right on our online assessment page. So completing the assessment gives you multiple opportunities to celebrate your success. For schools that meet the bronze level, they will also meet the bronze level for the USDA's Healthier U.S. School Challenge. In addition, Let's Move Active Schools adopted the bronze criteria for physical education and physical activity, and I am going to talk about Let's Move Active Schools here in a couple minutes. But this means that schools who earn the National Healthy Schools Bronze Award from the Alliance for a Healthier Generations Healthy Schools program can actually earn 3 awards at once. And if you haven't noticed by now, I hope you can recognize that the Alliance does nothing alone. Collaboration is inherent in our name. We collaborate with organizations to make sure schools have the best possible resources available to create and sustain a healthy school. And the updated School Health Index is just one example of collaboration. Another is our product calculator to help schools implement the USDA Smart Snacks. We've also collaborated with the School Nutrition Association on resources to help schools prepare for Smart Snacks. I know at times it can be difficult for schools to keep track of what each organization offers, and that's why the updated School Health Index and our framework of best practices criteria acts as a roadmap as schools collaborate with other organizations to see how they can most effectively and strategically use those organizations' resources. So I'm going to take a moment here to have our second poll. And it should pop up here in just a minute. So I want to ask you and get a sense if any of you have accessed and used resources from some of those organizations that were just up on that page, those organizations who have collaborated with the Alliance for a Healthier Generation, like the USDA, Fuel Up to Play 60, Action for Healthy Kids, Safe Routes to Schools. So if you could just take a moment to let us know if you've accessed and used resources from any of those organizations. Great. Seems the majority have, and we do know that there is an abundance of high-quality resources out there that schools can use to effectively implement policy and programmatic change, and I'm happy to see that some of you have been tapping into those resources. And in fact, completing the School Health Index can really help schools better understand the specific ways that each of these organizations can help them reach their wellness goals, as well as our shared vision of a healthier generation. So thank you for taking the time to complete that. And I think I have control back. Yes. So the Healthy Schools program actually gives you direct access to a lot of these resources, to a tremendous amount of resources to support your school's efforts. We have a resource database with hundreds of science-based quality resources, grant opportunities, and discounted materials from a lot of those organizations that you just saw, as well as some of our own.
I'm sorry, Megan, can I just interrupt you for just 1 second? Would you please reshare your screen?
Sorry about that, yes. Okay, show my screen, there we go.
Sorry about that.
That's okay, I'm sorry. Oops. Okay, can you see it now?
Yes, we can.
Okay, great. So this is just a little snapshot of our resource database, the resources I was just talking about. And then we also have professional development opportunities for school staff to learn and network. In addition, we have a customer support center staffed by live school health guides to offer guidance to schools, answer questions, and to help you overcome obstacles. We have a staff of national school health experts who provide one-on-one support to address your needs dependent upon the content area you're looking to focus at. As I mentioned, we also have a product navigator and our snack foods calculator to help schools select healthier options that meet the USDA Smart Snack guidelines. And in fact, if you go to the USDA's website, you will find them pointing you to our Smart Snacks product calculator to help you determine if the products that you are selling in your school meet the USDA Smart Snack guidelines. And you can find these at healthiergeneration.org/smartsnacks. So to access our tools and resources to help you get started in the Healthy Schools program, from building a school wellness council to completing the assessment and then creating an action plan, schools should register at schools.healthiergeneration.org. If you are already a Healthy Schools program school, you can simply log in with the same email and password that you always used. Our website may look a little different now because we did actually update it over the summer. And after you log in, you will see the left side menu makes it very easy to go between your school's dashboard, your assessment tool, action planning, accessing resources, and you can click on any of the modules to start completing the updated School Health Index questions. And to find out a little bit more information about the Alliance as a whole, you can go to our website at healthiergeneration.org or connect with us on Facebook or on Twitter. And I'm now going to actually shift gears a little bit to talk to you a little bit about another initiative that we are partnered with, and that's Let's Move Active Schools. Let's Move Active Schools is a comprehensive program that empowers school champions to create active environments that enable all students to get moving and reach their full potential. We know that the physical activity guidelines for Americans issued by the U.S. Department of Health and Human Services recommend that kids should have 60 minutes or more of physical activity each day. And the quantity of instructional physical education that's recommended is 150 minutes per week at the elementary level and 225 minutes per week in middle schools and high schools. However, in today's educational climate, schools across the country are struggling to integrate physical activity into the school day and to develop quality physical education programs. Only 6 states actually require physical education in every grade, K through 12. And only 3.8% of middle schools, 7.9% of middle school, 3.8% of elementary schools, 7.9% of middle schools, and 2.1% of high schools provide daily PE for all students in all grades in the school. Recognizing the severity of this issue and the opportunity for change, First Lady Michelle Obama, in partnership with the President's Council on Fitness, Sports, and Nutrition, the Alliance for a Healthier Generation, and Shape America, launched Let's Move Active Schools in February 2013. These partners, along with a remarkable team of supporters, have united around one vision to bring about an America in which physical activity is held as a core value and where active living is the norm. Let's Move Active Schools provides the support schools need to get moving. From the Let's Move Active Schools website, participating schools will have access to activation grants. After completing their action plan, school champions are encouraged to apply for one-year grants to kickstart quality programs. They have access to professional development opportunities, free in-person professional opportunities, as well as on-demand virtual opportunities. We also have technical assistance and customer support, as well as free resources with access to toolkits, webinars, videos, and other digital tools. And these are just some of the features and tools that you have available on the Let's Move Active Schools website. As a managing partner, the Alliance for a Healthier Generation is contributing our experiences, best practices, and talent to the partnership through our content expertise, our professional development and training, our customer support center, and our same continuous quality improvement process for schools to self-assess, develop an action plan, and celebrate successes. And in fact, Let's Move Active Schools is the Healthy Schools Program physical activity and physical education strategy. In that, the criteria that makes up the assessment is the physical education and physical activity criteria contained within the Healthy Schools Program School Health Index. It's just much more of a narrow focus. Let's Move Active Schools is a great introduction to schools looking to get started in building a healthier school by first focusing on quality physical education and physical activity. So how can schools get started? Well, the first step to be a Let's Move Active School is to enroll at www.letsmoveschools.org. And you'll notice that the website looks very similar, just maybe some different branding and color to the Healthy Schools Program website, and that's because it's powered in much the same way and works virtually the same way as the Healthy Schools Program website with just a much more narrower focus. So once you're part of the program, you would add your school and assemble your team in much the same way you would at the Healthy Schools Program website. And after you've added your school, you would have access to the customized online assessment, an action plan, as well as resources. If you're already a Healthy Schools Program school, one thing you should know is that you do not actually need a separate login for the Let's Move website. You would use the same Healthy Schools Program login information to log into the Let's Move website. In addition, if you've completed an assessment on the Healthy Schools Program site, the answers to the criteria contained within the physical education and physical activity sections of the Healthy Schools Program assessment will automatically be transferred to the Let's Move website, making it seamless and easy for you. So in summary, quality physical education and physical activity programs are a vital part of the educational process. Schools play an important role in teaching youth how to adopt and maintain a healthy lifestyle. Let's Move Active Schools is a tool to assist in addressing a school's own reality in regards to physical education and physical activity and to focus everyone's efforts in the same direction. And with that, I'm going to turn it back over to Alicia and Matt, and thank you very much for your time. And I'm available to answer any questions you might have about the Alliance for Healthier Generations Healthy Schools Program or Let's Move Active Schools.
Thanks, Megan. We really appreciate you sharing all that information with us today. Give me one moment. I'm going to bring our screen back up here. Not that one, sorry. This one. Okay, sorry about that. So yes, as Megan mentioned, we are going to spend a little time now and answer a couple of questions. We had a few come in, and two actually for Megan, and so I guess I will start there. So the first question was, if schools are using the School Health Index on the CDC's and Healthy School Program websites, is there a way to import or export the data?
That is a great question, and currently we do not have that functionality available. We're hoping to in the future. It'll be at least a year coming, but you can actually print out your answers and be able to transpose the data from one to the next by printing it out and then entering the data. I do encourage schools, though, that are really focused on physical activity, nutrition, and staff wellness to first go ahead and enter the data on the Healthy Schools Program website, and then you can, because that way you'll be able to access the action planning feature and tools and resources to help you actually implement any programmatic and policy change you want to focus on in those areas. And then afterwards you can print out the answers and go and enter them into the School Health Index on the CDC's website.
Thanks. Okay, so another question that we have here is, why should a Healthy Schools Program school sign up for Let's Move Active Schools?
Well, another great question, and there are a number of reasons that a Healthy Schools program school would want to actually register and complete the assessment on Let's Move Active Schools. First of all, we know the Let's Move brand is pretty big, and that way a school can actually associate themselves with a really visible brand across the country. But it also gives them another opportunity to be nationally recognized. And in fact, some Healthy Schools program schools, if they are looking to earn an award but don't necessarily qualify for the Healthy Schools program award because they may need areas of improvement in some other areas like nutrition, but if they have quality PE and physical education and meet the bronze criteria in those areas, the Let's Move Active Schools program gives them the opportunity to earn recognition for those efforts. In addition, Let's Move Active Schools receive priority for activation grants, such as those grants available through Fuel Up to Play 60 and Childhood Obesity 180. They will receive the priority funding if they are noted as a Let's Move Active school.
Thanks, Megan. That was a very informative answer. I have another question that came in here that says, I'm a parent and wondering what you suggest as the best way to gain support from school administration. And then the second part of the question is, how about support for forming a wellness council? So the first part I will answer about gaining support from school administration. And in our experience in working with schools, we really say that data is the best way to gain support from school administration, and we know from working with schools that that can be a very scary word. But really, one of the best data sources you can use to prove to administrators that this is such an important topic and deserves the attention is by completing a needs assessment, or at least a part of a needs assessment in the area of school health or wellness that you'd like to initially gain support for. So if it's a physical activity or nutrition, starting with those sections of the assessment and showing your administrator where you may be having successes and also areas for improvement can make a great case for gaining support. In addition, you can use national level data, looking at childhood obesity rates across the country or even within your own state, and you can find resources to access that kind of information on Pro Wellness's website, which I'll show you in a few moments, and also on the Alliance for a Healthier Generations website. And then as far as support for forming a wellness council, if you're looking for wellness council members, we really just encourage you to make the ask. And what we mean by that is there are far more people in a school and in a school's immediate community that want to be involved in health and wellness than what many people think are out there. But parents and administrators and school nurses, PE and health teachers, you name it, there's somebody out there who's interested in health and wellness just like you are. And really what it comes down to is just making that ask, putting a flyer out that says we're interested in starting a wellness council, and we'd like to know if you're interested in joining. And we found that to be very successful for schools.
Alicia, can I add something?
Please.
So I completely agree with you about, going back to the research and the data, when speaking to administrators, and we've definitely found that in our experience. We do at the Alliance also have our Healthy Schools Program ambassadors, and those are folks that we've worked with directly at schools, and they range are in a variety of roles. So we have everybody from superintendents to cafeteria managers to school nurses, as well as we have some principals. And you can find them on our website as well. Just look under School Ambassadors and you will be able to find a little bit more information. They have some good tidbits of experience. But I wanted to point out one resource that we have, which schools have found tremendously beneficial to helping them with their wellness committees, as well as to finding what kind of language works when they're talking to different roles within their schools, including administrators, and that's our School Wellness Council Toolkit, and that can be found on our website as well, in our resource database, as well as on if you go to take action schools and look under wellness councils and wellness policies. You can find it on one of those pages. And that toolkit contains everything that anybody in the school community might need to get a wellness council up and running, from who to ask, how to ask it, sample language, sample letters, sample talking points, the rationale. It does talk about, the data linking health and academics, why it's important, as well as sample agendas, and a timeline for everything that somebody might need to get a wellness council up and running is contained within that toolkit.
Thanks, Megan, for adding that on. That's great resources for our guests here today. We have time for a couple more questions, and I do see a few more here. So the next one we'll answer is, can child care centers not located on school district buildings access and use these tools?
I think I can take that one, Alicia. The answer in short is yes. We encourage you to explore all the tools. Some of them have specific questions for educators and some that anybody could answer. So we would encourage that you collaborate with the schools or find somebody that is also interested in assessing these schools and see if they work for them. Then you can maybe get access to all of the questions. In addition to this, we're also developing a resource for our website, which will provide links to certain tools that we had kind of mentioned today, and we would be happy to have that up for you in the next day or two.
Megan, is there anything else that you'd like to add to that question?
Yes. Actually, the Alliance for a Healthier Generation also has an assessment tool for out-of-school time settings. So it includes child care centers. I don't know if you're talking about early child care. Our assessment isn't particularly adapted for that, but for K through 12 child out-of-school time settings, we have what's called our Healthy Out-of-School Time Framework and Assessment, and you can find that at healthiergeneration.org. And it works the same way that our Healthy Schools Program framework works. We have help for building support, building a site team, completing an assessment, developing an action plan, and so forth. And it's the same healthy eating and physical activity standards that have been adapted by the National After School Association.
Great, thanks for sharing. We actually had another attendee on the webinar today share another resource with us that we think that you'd like to know about. PA Knapsack is the acronym, and it's an online self-assessment tool for early child care centers. So if you'd like to look that up, and we will also be sure to include a link to that on our website when we are able to look at that information and get it together for you. Another question that has come through is, how do you keep wellness committee members at under-resourced schools from being discouraged by low assessments? And I think this is probably another question that both Megan and our group can add something to. At first thought on this, it comes back to this idea of celebrating successes. So every school is doing something well in terms of health and wellness. And while it can be discouraging, I know, to maybe complete an assessment and realize that there are maybe more areas that you're not doing well in as compared to areas that you are, every school has to start somewhere. So really that would be the approach that I would take in terms of talking about how to sort of overcome this discouragement that comes with maybe a lower score on an assessment, and just know that it's a starting place, and continuing to do these assessments annually or biannually can show progress over time and really start to turn that around. Megan, do you have anything to add?
No, I think you addressed that perfectly, how we would address it, just to really focus on the successes, the things that you are doing well. When creating an action plan, pick the low-hanging fruit. Pick those things that would be easy to accomplish. Just focus on one thing at a time, and celebrate it and share that success with the entire school community, and really shout it to the rooftops what you are doing, because that really helps to build momentum and gets folks on board with what you're doing and want to create more successes ultimately.
Great. I think we have time for one more question. And if we didn't get to your question today, please know that we will put answers to all of the questions that you submitted today on our website. So if we said something you were interested in and you didn't get to jot it down, we'll put a question and answer document on our website with the recording to today's webinar. So are there advantages to doing a building level assessment versus a district-wide assessment? Megan, would you like to take a first crack at that?
Sure. So our assessment tool is a building level assessment, and we found every school is going to be unique in what their priorities are, what's important to them, what's going to be feasible and achievable, and it varies depending upon the level of support they have from the school community and the parents. So I think it's the advantages is that every school has unique priorities and needs, and so how they're going to go about creating an action plan really depends on the school community as a whole. But at the district level, completing a district level assessment tool can be very advantageous as well, because that enables districts to be able to identify where they want to devote their resources to, where their greatest areas of need are, so that as a whole they can have the greatest impact for the district-wide population.
And I would just like to add one point to that. When determining what type of funding you're looking for, if this is for funding purposes, you may want to consider doing a district-wide assessment just to kind of get a whole grasp and really maybe reach out for those higher-end funding opportunities. This will provide a perfect overview of what's going on in the district, and then you can really target specific areas, give them specific action items that you would like to work on, and then I'd say you're more likely to hopefully get one of those big grants.
Yeah, and in addition, I think when it comes to looking at policies, so policy, of course, is a buzzword in school wellness world right now, and we love to see policies that are enacted at a district level. And while it's important to know what's going on in each of the buildings, sometimes looking at both a building level and then at a district level can allow you to create all-encompassing policies that then can be maybe implemented specifically at each individual school building. So there are certainly advantages and reasons for collecting information at both a building and district level.
Mm-hmm.
Okay, so I think that's all the time that we have today. We really appreciate everybody coming out today and listening to this webinar. As I mentioned, we will have a recording of this webinar available on our website in the next few days. We also will release that information in email format with a link that will direct you right there. If you requested a certificate of completion, that will be available in the email, and we hope that you'll provide us feedback in a survey that is also included in that email. It's very brief, and it really helps us to make plans for future webinars and opportunities like this. So again, we want to thank Megan for taking the time today and sharing some truly wonderful information with us. We hope that you enjoyed the content of today's webinar, and we would be happy to answer questions on any of the content that you heard about today or anything else related to school wellness in general.